right, sorry for the technical difficulties, but we are now live. So I want to thank everyone for joining us this evening, and also want to thank those that are going to watch on YouTube and Facebook. So this afternoon, or this evening's program is called Prioritizing Health Over Tobacco Industry Profits. For decades, the tobacco and vaping industries have strategically and successfully targeted Black, LatinX, and LGBTQ plus communities with their addictive products. Of these unjust tactics, the racial targeting of the Black community with menthol cigarettes has had the most negative impact. Fast forward to 2015 and current day, and the tobacco and vaping industry came out with electronic cigarettes to addict a new generation on nicotine with similar marketing tactics. This presentation will explore the history of injustice within the tobacco and vaping industries and the action steps Massachusetts has taken to prioritize community health over tobacco and vaping industry profits. And tonight's presentation is led by Ashley Hall. Ashley is the program manager of the Northeast Tobacco Free Community Partnership, funded by the Massachusetts Tobacco Cessation and Prevention Program, a program of the Mass Department of Public Health. Ashley is a free resource for 49 communities in Northeast Massachusetts on tobacco intervention efforts. Ashley has her Master's of Science in Health and Wellness Management from Merrimack College. I'm a fellow alum, Ashley, and is certified in health education and literacy. She is also an adjunct professor at Merrimack in their School of Health Sciences and the liaison for the college's nursing students. In her personal and professional life, she spends most of her time in authentic anti-racism work. As it relates to her tobacco partnership role, she is focused on educating and mobilizing communities about the tobacco and vaping industry's tactics to addict populations to nicotine and taking action steps such as passing local policy and implementing free programs to help people quit and stay informed. So let's all please give a big virtual round of applause to Ashley for joining us here tonight. And Ashley, the floor is yours. You can take it away. Thanks.
Thanks so much, Robert. Good to virtually see everybody, and thank you so much for joining us tonight. And without further ado, we will get started with the presentation. So I guess I don't really need to introduce myself any further. Robert gave me a fantastic introduction, but just again to reiterate, I am funded by the Massachusetts Department of Public Health's Tobacco Cessation and Prevention Program, which is housed at Greater Lawrence Family Health Center. I'm also local to the region. I grew up in Lowell and now live in Tewksbury, and so Tewksbury is very close. Just to start with the background information, in public health, a big part of what we do is prevention. If you can't get sick in the first place, let's work on that. So tobacco is the #1 cause of preventable death and disease. Simply put, by not using tobacco, you can prevent having the death and disease that comes with it. Things like chronic obstructive pulmonary disorder, lung cancer, mouth cancer, things like that. So we really want to focus on the prevention. But why else should we address tobacco use? A lot of people think, oh, it's just smoking, no big deal. But we actually know that smoking-related illnesses kill more people than HIV/AIDS, car crashes, murders, drugs and alcohol combined. So it's a huge issue when you think about those numbers from all of those other issues, combine all of them, and smoking is even more than that. So it's really not something to be dismissed. We also talk about the costs, especially now in our pandemic climate. Cost in financial income is a big issue for a lot of us, between the economy fluctuating and maybe unfortunately some of us have had some job changes. We're all looking for ways to save money right now. An easy way to do that is by staying tobacco free. We know how economically burdensome tobacco can be. Someone who is a pack-a-day smoker, they spend about $10.19 for a pack of cigarettes, which is over $70 a week. and over $3,000 a year. And to put that into perspective for you, that could help pay for your new apartment, a vacation after COVID, and maybe even a down payment on a car. So you might think, oh, well, 70 bucks a week, not too bad. But when you think about the other things it could buy, that could keep you a lot safer, happier, and healthier. It's really a huge way to save money and maybe splurge on things that are more necessary. And like I said, the pandemic is having a big impact on us financially, but we also are starting to find that COVID-19 is linked to smoking and vaping as well. So when you think about it, smoking and vaping attacks the lungs. You inhale the smoke or the aerosol into the lungs. And COVID-19, we also know, is a pulmonary virus, pulmonary meaning lungs. So since both the virus and smoking and vaping attack the lungs, we know who people that smoke and vape may be at a higher risk for COVID-19. They might be at a higher risk for catching the virus, spreading the virus, and having a more serious infection. Your lungs have specific parts in them whose job is to fight off infection. But as soon as something other than clean air is inhaled into the lungs, that part of the lungs can't do its job as well. So it can't fight off the infection like it should. So that might be the difference between someone who is at home really sick for a couple of weeks versus someone who may need hospitalization and serious treatment. So knowing this, it's a really great time to encourage the people in your life to make an attempt to quit smoking, and also yourself stay smoking tobacco free. It's not easy to quit though, we certainly know that, and that's because of the addictive element in tobacco, which is nicotine. We know that when you're prolonged nicotine for a very long time, you're going to want to keep inhaling the smoke, which puts you at high risk not only for COVID-19, but those other diseases that have been around forever, which again are the #1 cause of preventable death. So things like lung cancer, COPD, all of those health issues. And for that reason, we need to remember that tobacco should be treated and thought of as a chronic relapsing condition. It's not something that's like a one and done. I talked about it with my doctor once and we're good. It's something that should always be brought up and addressed. And remembering that it's not easy. And we know that nicotine is not only impacting adults, but youth, as you can see here. This visual comes straight from our vaping campaigns within our program, where we really are trying to let youth know that, they know cigarettes are bad for them. We did a great job at teaching kids that smoking and cigarettes are bad for us. But then on the left here, you see the vape, the Juul. And as soon as that came into play, kids forgot about all this stuff here on the right. They forgot its addiction from nicotine and cancer-causing chemicals. So specifically, when nicotine is entered into the adolescent body, we know that they're going to have much harsher impacts at such a young age. We know that people as young as middle school, and I've even heard through conversation that kids as young as elementary schoolers are starting to get their hands on vapes because they're really curious as to what it is, which we will talk about later on. And we know that kids who start vaping at a young age are 4 times more likely to turn to regular cigarettes, the traditional cigarettes like we've seen, than kids who don't vape, because eventually they're going to want the stronger addiction, the stronger product, because of how addicted they are. We also know that one of the #1 things that kids are doing, whether it's virtual or in person, is learning. They're in school 5 days a week, maybe 7 to 8 hours a day. And as soon as nicotine's in the brain, many normal functions are interrupted. Kids can't learn as well, their memory is impacted, their appetite, their mood. So that's a lot of the mental things. So that all of a sudden, their ability to be a good student for memorization, learning is interrupted, but also sometimes the physical symptoms. So I've heard many stories. I work with a lot of the local schools, and I've had parents, teachers, coaches tell me that their #1 athlete who was set for a college scholarship was always the first person to finish in sprints, the star athlete on the team. All of a sudden was last to finish by far in the team's running drills and things. And that was because the vape products were impacting their lungs. So they didn't have the lung capacity to deep breathe and keep up athletically. So your kid might be someone who isn't as athletic. They may not be playing sports, but they're definitely learning all day. So it's really a good thing to remember both aspects to it. We also know that certain groups have been targeted. So youth vaping is one example, but tobacco industry's targeting starts way back before current day with vaping. We know the tobacco and vaping industries targeted specific communities with menthol cigarettes, mainly in Black and Latinx communities, and mainly in communities with multi-unit housing. So that's places where the walls are really your only barrier, and smoke knows no barrier. Smoke will travel through vents, through walls, windows, etc., exposing people who might be living in a unit that isn't smoking, but they're getting exposed because of neighbors. So tonight, we're going to use menthol cigarettes as one example of how the tobacco industry targeted these specific communities. And to give you a break from me and to listen to someone who explains it much better than I do, I'm going to show you a 2-minute video which is part of a full 15-minute documentary called Black Lives, Black Lungs.
Three years ago, I accepted an internship with Truth Initiative. At the time, I thought I knew everything I needed to know about tobacco, but what I knew was just the beginning.
One of the greatest marketing coups that took place in the 20th century is transforming menthol cigarette to a black cigarette.
During my time with Truth Initiative, I read dozens of research articles and stacks of internal documents directly from tobacco industry files. The tobacco industry strategically and successfully infiltrated my community. And while it's true that they targeted many groups, the targeting of the Black community has been uniquely damaging.
So it was good to see Black people in the ads and to see that there were Black models and that people saw that and they were very much attracted to that. It was sort of a double-edged sword.
They do target everybody, but when they target us, we die disproportionately from it.
We know the facts. We have the scientific knowledge that tells us that we die in larger numbers.
Tobacco-related diseases are still the #1 cause of death in the African American community.
47,000 African Americans a year die as a result of tobacco-related diseases.
Somewhere in the neighborhood of 90% of all African American civil, religious, political, social organizations take money from the tobacco industry.
Behind the scenes, there were negotiations between the leaders of these organizations and tobacco companies.
Because there's money tied to it, and money makes things happen.
Because of who we are, our lives are constantly at threat.
Black Lives Matter, hands up, don't shoot. I can't breathe. I think we're all answering the same question. What is the worth of a Black body in the United States of America?
So I have seen that video dozens of times, and I still get goosebumps at the very end when she's saying, hands up, don't shoot, I can't breathe. This video was created a couple years ago, and we know that headlines like that are making the news today. So it shows you that this isn't a new issue we're fighting, and it's probably not going away anytime soon, which is why we are here trying to take steps towards it, at least in this issue here of tobacco, and broader as well. That's a lot of emotional, hard information to take in a short period of time, but we're gonna debrief a little bit about it. So right here, you see the ads that were starting to be shown in that video. These are real ads from the 60s and 70s of menthol cigarettes. And just like he said in the video, it's really great to see representation. So we're seeing Black people in advertisements, but it's not advertisements for new clothing or a gym or food, but it's advertisements for the thing that's killing the people of the African American community the most, just like you heard in the video. And they all look fantastic, right? So I always say I'd want to hang out with every single one of these people. They're at the club, they're in love, they're having fun, they're dressed nice. So Black people said, wow, I see myself in these posters. It's really great to have representation. I want to be like them. What are they doing? They're smoking menthol cigarettes. And so I want to be like them. I'll smoke menthol cigarettes. And I've actually had the pleasure of seeing one of the gentlemen in that video speak in person last October, Philip Gardner. He said to me, he remembers being a kid out in the neighborhood and a truck would come by, like an ice cream truck, and they would hand out free menthol cigarettes to the people that lived in his neighborhood, which were Black by far. And it only took that many for him and his friends to start to like them. And then it only took that many more to become addicted. And now, of course, he's learned about how he was specifically targeted because of the color of his skin. And he's taken anti-racist steps to let other people know about that information, and really fight the industry's racist combat the industry's targeting. And in case you need further evidence, here's a direct quote from R.J. Reynolds, one of the biggest tobacco industry giants. He was asked why he doesn't smoke. He's the executive of the tobacco industry. Why doesn't he smoke? And he replied, "We don't smoke that," expletive. "We just sell it, and we reserve the right to smoke for the young, the poor, the Black, and the stupid." So that's a direct quote from the person who was making these products that just brings home the point that they took menthol and advertised it to this community on purpose. So that was information from the 60s and 70s, and this is information from our survey in 2012 to 2014. Adults, or anyone 12 and older who use menthol cigarettes, by far, you can see by race and ethnicity that Blacks were the community that used menthol tobacco the most. So the data really doesn't lie. It shows you that whites were the least. And then groups like Black, LatinX, and Asian were targeted the most by being lifelong users of these products. So then and now, let's tie it all together from the past to the present. So we saw menthol cigarettes. And in case you're unfamiliar with menthol cigarettes, I'd like you to think about when you're sick, if you've ever had a mint cough drop, or maybe you've had a sore muscle and you've used something like Icy Hot or BioFreeze. And so you know that cool numbing feeling you get from using either of those products, that cooling and numbing agent is menthol. So that's exactly what menthol does. It cools and numbs pain to make you temporarily feel better. So when you take something like menthol and put it into something as harsh and burning as a cigarette, all of a sudden your throat is coated in something cool. Like, again, imagine if you're chewing on mint gum, it feels cool and refreshing. So now, instead of feeling harsh and burning and painful, menthol cigarettes feel cool, which allows somebody to inhale more smoke for longer periods of time. So now the addiction is stronger and the damage happening inside of the body is even worse. So that's really the harm behind menthol cigarettes. Not only is it a justice issue because the industry targeted these communities by putting more ads and making them cheaper, but we know how harmful the product itself is. So it's really a huge social justice issue. And it was in the 60s and 70s. And menthol cigarettes sort of started to phase out as the times changed. So then we saw mint in chewing tobacco. And then we saw mint snus, which is about these pouches you see here. And this is something that's become a little bit increasingly popular in youth. Because unlike chewing tobacco, where you have to spit it out, the snus packet dissolves completely in the mouth. So kids who were addicted to nicotine were using this product to get the nicotine buzz without being obvious. And then we started to see these products take from this traditional, this chewing and smoking form into this liquid form for vaping. So you see here, Arctic Air. And although that doesn't explicitly say menthol, anything with that cool minty flavoring is a menthol tobacco product. And I'm sure you've all heard of the vape giant Juul. So Juul came out with mint Juul pods. And then we had disposable vapes, which are puff bars, is a really common brand among youth, come out with a menthol vape, and all sorts of vapes. So you see here how we transitioned from packs of menthol cigarettes into some chewing tobacco, and now all of a sudden tobacco is electronic. But one thing has remained constant, and that's the flavor of menthol. And again, menthol is so detrimental not only because of the justice issue, but because it's an easier product to smoke, an easier product to start, and a harder product to quit because of how cooling and good it feels on the throat. So again, the main focus of this presentation is the industry's tactics that started these injustices, but we're just going to do a little bit of Vaping 101 recap so you sort of understand the products as well. I usually, when I present in person, ask for a show of hands. How many of you have heard that vaping is just water vapor? And usually every single hand in the room goes up. I was actually at a doctor's appointment just a couple of weeks ago, and I was telling the nurse what my job was, and she said, "Oh yeah, vaping, that stuff's scary, it's water vapor." That was a nurse from a very well-known hospital. It's actually not water vapor, it's something even worse, it's an aerosol. And so to sort of put that into perspective for you, something like hairspray is also an aerosol. So if I took hairspray and sprayed it on your arm, it would leave that sticky residue, right? It would leave that greasy, sticky residue. And if you take that same analogy and make the hairspray a vaping product and make your arm, your lungs, that's exactly what's happening inside of the body. It's chemicals that are being heated up hot enough to be the smoke that you see, except it's aerosolized smoke that's coating the lung in chemicals. And it's a battery-powered device. So we're still doing a lot of research on vaping, but here's what we know so far about what's in that aerosol cloud. Since these are battery-powered devices, there's often metal in the devices themselves. So the vaping products, when they're heated up, that metal we found is leaving the metal product and being inhaled into the body. So metals like nickel, tin, and lead have been found in the clouds of vaping. Cancer-causing chemicals, nicotine, again, that extremely addictive element getting into kids who are maybe as young as 13 or younger. Ultrafine particles, and diacetyl, which diacetyl was banned from microwave popcorn because it was so oily, it was causing the factory workers to get sick. Yet diacetyl is being used in the liquid for vaping because how oily it is, it helps the e-liquid. But we know how harmful it can be to lungs. So that's your vaping background. We know that in 2019, over half of all high school students in the state said that they had ever tried vaping. That's an alarming amount. And that could be someone who tried it once, or it could be someone who does it 30 times a day. And we know that kids, from my conversations with schools and parents, kids who use the Juul vape, one of the more popular, smoked about 1 Juul pod a day. A Juul pod is about the size of your thumbnail, right? But it holds the same amount of nicotine of an entire pack of cigarettes. And to put that into perspective for you, kids smoke about 1 Juul pod a day. So that's kids as young as high school getting the nicotine equivalent of a pack-a-day smoker. So knowing all of that, how did we get here? And it can really be summed up into these tactics. The tobacco and vaping industries made their products sweet flavored, like you see here on the bottom. Things like, of course, you see menthol in this white bottle, cinnamon roll, green apple, all of these sweet flavors that sound like a dessert. They made them super cheap. So you can see here in the picture, Juul, the most popular vape among kids, is being advertised for $20, $15 off. And advertisements and the products were placed in stores you go to every day. Things like gas stations, convenience stores, grocery stores. So they're stores that kids go in all of the time. And I'd like you to pause for a moment and think about if that sounds familiar. Flavors that people like, cheap priced, lots of advertisements placed in everyday places. Those are the tactics the vaping industry used, but if I was in here with person with you, do those tactics sound familiar? They're essentially the exact same advertising tactics that the tobacco industry used in the 60s and 70s with menthol cigarettes, except now these take electronic form. And if you need more convincing, we're going to compare real life advertisements. So you see here an advertisement for vaping, an elegant woman in a beautiful dress smoking her cigarette, right? She seems perfectly healthy and beautiful. And here's an advertisement for blue e-cigarettes, which e-cigarettes and vapes are the exact same thing. They just have many different names to make our jobs more difficult. So you can see here that the imagery is uncanny. It's two beautiful girls in a long dress sitting in a chair, except decades apart, with two different products, both harmful and addictive. And here you saw this picture in the Black Lives, Black Lungs video, advertisement for menthol cigarettes. And here's an advertisement for Juul. Again, young people having fun, looking super happy. Maybe they're in a relationship. One's the cigarette, one's the electronic cigarette. And lastly, everybody knows this guy. Santa was used many times in cigarette advertisements. And of course, people of all ages like Santa, but we know specifically kids really like Santa. They really like Christmas and getting all of the gifts. So he was used for cigarettes and he was used for e-cigarettes with vaping. And both of these have a quote from Santa saying, "Luckies are easy on my throat." And then on the vaping one saying, "I don't always vape, but when I do, I choose this brand, Kris Kringle." So you see the products are different again, but the same advertising tactics were used. And I showed you a couple of the vaping products, but the tobacco and vaping industry is always trying to think ahead. So you saw cigarettes, you saw menthol cigarettes, you saw vaping products, you saw the advertisements, but there's always emerging products to sort of be on the lookout for, just for your own FYI, especially if you're someone who has young kids in your life. So you see here, these are neon green, neon pink, and if you saw them in person, they actually sort of mimic a flash drive. They're sleek and slim and super light. But if they have a little symbol on the bottom or they smell fruity, it might be a sign that it's not the flash drive your child's using for remote learning. It might be a vaping product. Here's the snus product I talked about, the tobacco that dissolves into the mouth. All of these vaping products that look nothing like traditional cigarettes. And one thing to really be on the lookout for now, again, especially if you have youth in your life, is the tobacco industry is starting to come out with wellness vapes. And I say that term very lightly because it's sort of an oxymoron. But right here you see a brand called Cloudy. And Cloudy is a diffuser with lavender, melatonin, chamomile, except it's not a diffuser at all. It is a vape. So melatonin, chamomile, and lavender are perfectly healthy for you to have in your tea or maybe in a bath, but should not be inhaled into the lungs. And kids are being so blinded and tricked by the way it's advertised as being something that's calming to help you sleep, that they're buying this product and inhaling this into their lungs, causing so much damage. So again, just products to be on the lookout for. The good news, right? Maybe that was a little bit of a downer for you, but the good news and what we're here to talk about tonight is that Massachusetts has taken action steps to combat all of that unjust targeting done by the tobacco and vaping industries. So in December of 2019, Massachusetts became the first state in the entire country to take menthol tobacco and all flavored vaping products off of the shelf of retail stores. A huge, huge step. We know that a lot of the community who has been disproportionately impacted, so everyone from youth who use these vaping products to the Black and LatinX communities who were targeted with the menthol tobacco, we know that they've said, I would quit if I didn't have access to it. But because I go in to get my gas a couple times a week or once or twice a week, and I see the menthol cigarettes on the shelf and they're priced so cheap, I want to buy them. But if they weren't there, I wouldn't have the urge to buy them. So that's part of the reason why we took a menthol tobacco away. And we know that kids are the same way. When they're exposed to the flavored vaping products, when they see something that looks just like Sour Patch Kids, but it's Sour Dream vaping, they're tempted to buy it. But when it's not right in front of them, they won't buy it and they'll probably be vape free. So that was really the basis of this law. The law is called an Act Modernizing Tobacco Control, and it's a huge, huge step towards racial justice and health equity for the Commonwealth. It's a really big law. Again, we're the first state in the country. It took a long time to pass. So we're really fortunate that Charlie Baker and a lot of youth were involved in this project, this law as well. There's a lot of other pieces to this law, and I just went through it really quickly. So if you're interested in reading more about it, I encourage you to check out the website, mass.gov/new tobacco law. What you'll see on there is a little bit more explanation of this piece here. They're no longer being sold in retail stores in Massachusetts. The only place you can still buy flavored vaping products and menthol tobacco is what's called an adult-only licensed smoking bar. So that's a place that has gone through the legalities to allow smoking and vaping indoors. There's only about 20 of them in the entire state. And as a part of COVID-19, they're not an essential business, so they're not open right now. So that's just some background info for you. And you can certainly read more about it at mass.gov/new tobacco law. And it's a really good way to show what Massachusetts has done. Another thing that we've done to educate people about this law is a campaign. This campaign is titled No Menthol, No Why, and you can check it out more on our website. Again, one of the fantastic things about this law is statewide leaders, statewide youth who are passionate about fighting tobacco really took the lead on this. They wrote letters to legislators. They educated their community and their peers. And they're the ones that are the faces of this campaign. So this young lady you see here is a youth activist from Waltham. And every single face of this campaign that you'll see on the website are real people from Massachusetts who have been impacted by menthol tobacco. If you want to, again, learn more about the law, there's a quick 2-minute video on the homepage. You'll see information about why the law was implemented, how to help people quit, who is partnered with on the campaign, resources. And under this Take Action page, you'll see lots of other things too. So maybe you've had a story with menthol tobacco and you want to share, you can share your story. This woman here on the left is actually someone I work very closely with. Her name is Evelyn and she's from Lawrence. Former menthol smoker, cancer survivor, turned into tobacco advocate, anti-tobacco advocate. There's social media posts, there's virtual backgrounds for your Zoom, and press releases as well. So knowing all of that information, we want to talk about what you can do as members of Tewksbury or Greater Lowell, wherever you are tuning in from tonight. You want to talk about what you can do to stay involved. One of the best things you can do is simply just stay up to date with education. So you can check out our website, makesmokinghistory.org, and you'll see so much information on our website. You'll see information about helping people quit, smoke-free environments, a whole page about vaping, because again, you went a really high level tonight, how the tobacco industry targeted kids, and you can even get local information about whichever city or town you're calling in from tonight. So I really encourage you to check out our website to get up-to-date info. And again, we know that youth are disproportionately impacted. So the earlier and more frequently you have conversations with them about staying tobacco free, the more likely they are to do so. And it's not easy, right? A lot of parents say, well, I'm nervous about talking to my kid. Are they going to listen? How do I get started? So here's some tips for talking with your kids. Be patient and ready to listen. So it's really important to remember that we're trying to educate them and help them stay healthy. So instead of criticizing, we're just trying to have an open dialogue. And there's also no perfect time to talk. A couple months ago, pre-COVID, I was giving a presentation and a parent told me, well, I had the talk with my child when we were on a 5-hour road trip up north. That worked for them because they needed something to talk about. The kid couldn't run away to their room. So that might be a great time. What's another cool thing about the car ride is that you could use it as a segue into the conversation. So maybe you drove by a gas station and you say, did you notice that they're not selling, flavored tobacco anymore? Here's why. Or maybe you drove by a vape shop and you say, hey, that's a vape shop. Do any of the people vape? Does it scare you? What do you think about it? So really think about it as an open-ended conversation with lots of questions. And you may not have all the answers, and that's okay. At least you started the conversation, and maybe you can look into it more together. And you want to be open and honest. You might not have an answer, but our website might. So you can always look into it, and you can always contact me, or you can always put the blame on me as well and say, I listened to this woman, Ashley, talk. She said that vaping is an aerosol. It's like hairspray. Did you know that? So it could be used as a segue for conversation. You can totally put the blame on me. And we know, again, we want to encourage these people to quit. So youth specifically have 2 completely free coaching lines to help them quit. The first one's powered by the Truth Initiative. It's a confidential automated texting program. So youth who want to enroll in this program text to this keyword, to this phone number, and they get automated texting back to help them through their quit vaping attempt. And they can text specific keywords like craving, Massachusetts info, to get specific coaching back to them. And we know that's effective because kids always have their cell phone on them and are often texting. We also know there are some kids who may not connect with somebody via text, but would connect verbally over the phone. So My Life, My Quit is available both ways, call or text. And I use this phone number. Again, both of them can be checked out on the website, and they get connected to a live coaching specialist on the other line to sort of walk them through their quit attempt. So it's a trained live person on the other end, whereas the other one's automated. So really every kid is different, every nicotine addiction is different. So this really gives them the option to work what's best for them. If you're listening as a parent or guardian, one of the number one things you can do is encourage them to talk to their doctor, a trusted adult for help. It's really, no kid should have to go through this alone. It's a really great way to establish trust. So again, a great thing to do is talk to their pediatrician, maybe about what's going on. And here's just an example of some materials we created for places like schools and organizations. This is a wallet card, so it's a little bit bigger than a business card. And it has a checklist for kids to go through discreetly on their own to see if they're addicted to vaping. And on the back of this card is this information here on the left of the coaching lines. So it's a way for them to discreetly really analyze their addiction and reach out to help on their own. We also know, right, that adults need help too, no matter how old we get. So anyone who is 12 and older can also call the Massachusetts Smokers Helpline. They call 1-800-QUIT-NOW, and they get connected again to a trained live coaching specialist on the other line. 24/7, this coaching line is available. They get connected to someone again who asks them those questions to help them through the quit attempt. And once they go through medical eligibility, they can get up to 8 weeks of free medication. So that's the nicotine replacement therapy if they're 18 and over. So that's things like the gum, the patch, the lozenge, the inhaler, things like that can be delivered to them for free in up to 8 weeks of it. So it's a really, really great resource that we have here in the state. And again, just like kids, adults may be hesitant to pick up the phone and talk to somebody, but the Massachusetts Smokers Helpline is online as well. If somebody wants to just click around and explore before they make a phone call, they can check out the website. And what's really great is this website's been updated to include some of that background information with the relationship between smoking and vaping and COVID-19. And it's also available in both English and Spanish. So a really good way to start clicking around. And since we took menthol and flavored tobacco off of the shelf, leaving a lot of people looking for help to quit, we now have a $50 incentive program at the Massachusetts Smokers Helpline. So residents in Massachusetts can call, and if they use menthol tobacco, and if they have a behavioral health diagnosis, they can get $50. They go through 3 coaching calls, so it's a full coaching. It's not just a one and done deal. They'll get plenty of help. After the first call, they'll get $10. After the second, $15, and $25 after the third. So it's a total of $50 to get that help to quit menthol tobacco, because we know often people who have an addiction to menthol tobacco, it's a stronger addiction that's much, much harder to quit. So hopefully this $50 will help them quit. And just some background information, there was a lot of research done at the state about this incentive. And basically it's being offered because incentives help people. We know that when you incentivize someone about something, they're more likely to do it. So maybe someone has hesitation and they're worried about doing it. We know that when you have something based off an incentive, they're more likely to enroll and stay active in it. And we really know, since we know that Black and Latinx communities have been disproportionately impacted, we really want to help those communities with this, since they have been impacted the most by menthol tobacco. And we know that those communities are less likely to receive quitting advice from a healthcare professional. And we know they're less likely to be prescribed the medicine they need to quit. So this incentive is a way of saying to the smokers and to the doctors and providers that help them quit, here's a way that's going to incentivize you to start that conversation and make a quit attempt. Always important to stay educated. So this is a lot of information to throw at you in a short period of time. So these are great websites to use to stay updated on trustworthy information. So we have our DPH website, the CDC. The Truth Initiative is a great website. They have everything from smoking, vaping, and a really great report specifically about menthol. The CDC has a great menthol page, and then the National African American Tobacco Prevention Network as well. So the statewide policy passed, so we removed menthol for the entire state, but there's certainly still work that can be done at the local level. So if you are interested in saying, well, my city or town has, I went onto your website and I found that my city or town has 20 tobacco stores. That's way too much. There should be 2 maximum. That's something that I'm here to work on. I work with boards of health on passing local tobacco policy. And they really like listening to all of you, much more than me. So if you're interested in passing local policy, being a concerned community member really, really helps pass that policy. And you can check out what tobacco policies are on the local level on our website. And the Massachusetts Health Promotion Clearinghouse is a free resource. If you are somewhere and you want to order a handout, a poster, a sticker to help spread some of the information we talked about tonight, this website's completely free. You can go on and shop just like you would on Amazon.com or any online shopping, but when you check out, there's no payment information. You can order 5 or you can order 50 posters to hang up or hand out to people that you know, or you can download them. I know many of us are not in person right now, so maybe you still want one of these handouts, like the one you see here on the right that talks about youth vaping. But if you don't want to have a hard copy, you can download it and get the PDF copy to share with people as well. So again, that was a lot of me talking, but I'd love to hear any questions, comments, discussion that all of you have.
Great. So at this time, I would remind folks who are with us live on the Zoom, if they do have any comments or questions, to get them into the chat. Tony just wanted to thank you, Ashley. He said it's been a great talk with lots of info that was clearly communicated. He thanks you very much. And then he does have one question. He says, I Googled LGBT vape marketing the other day, and it was a real eye-opener. Ashley, do you work on that angle as well?
Absolutely, Tony. Thank you so much for mentioning that. I had a slide on that in here, but somehow it went missing. Yes, we absolutely do work on that. So the tobacco and vaping industry has long targeted the LGBTQ plus community, just like the Black and Latinx, but definitely the Black community has been the worst. But we do focus on all of it. So one example of the LGBTQ marketing, which I'm sure you saw, Tony, was take pride in your flavor. That was the tagline. And the products were in order of the rainbow. So using that word pride and that subtle imagery of having the colored products be in the order of the rainbow, that is definitely targeting specific to that community. And that is strategic and purposeful by the tobacco and vaping industries. So we absolutely do focus on that angle. Thank you for bringing awareness to that.
And so Ashley, it looks like that's all for questions for now. I did check social media and I'm seeing lots of likes and shares, but I didn't see any comments on the Tewksbury Library's Facebook page or on the Tewksbury Cares page or any of Maria's other pages. And I would just like to mention, and I apologize for not doing this up front, I did want to note that tonight's program is a collaboration between the Tewksbury Library and the Frontline Initiative. And I especially want to thank Prevention Project Manager Maria Ruggiero for making this happen. Really, she spearheaded this, and I want to thank Maria so much for bringing Ashley to our attention. So Ashley, with no other comments or questions, it appears, did you want to have any last words to the group here?
Really just a thank you to everybody for signing on. I know that things are crazy right now, so I really appreciate those of you who signed on live tonight. I'm so thankful that I work with Maria and you, Robert, for hosting me. And I'm more than happy to be a contact to anyone who has further questions or thoughts. So you see my contact information on the screen. Please do not hesitate to reach out. Don't be a stranger. More than happy to help. And I hope all of you stay safe and healthy.
Great. Thank you so much, Ashley. And I would just ask the folks who are watching live to help us amplify the reach of this video by sharing it on social media. It is on the library's Facebook page, and it will also be on the town's YouTube page, hopefully by tomorrow, if not by Thursday. So if you could help share those, it would be greatly appreciated. So thank you again all so much. Thank you, Maria. Thank you, Ashley. And I hope everyone has a great night.
One thing I forgot to add is that my program now is also on Facebook too. So if you searched Northeast Tobacco Free Community Partnership, you will see my page directly on there and you can follow us there as well. Thanks for the reminder.
Great. Thank you so much, Ashley. Thanks for the plug. And I hope everyone has a great night. Thanks again.